In the coming days, the Wall Street Journal reports that the Department of Health and Human Services is expected to stop recommending routine COVID shots for children and pregnant women. That's in addition to new testing requirements for vaccines that could delay the availability of shots that used to be updated each year without complicated trials. As a result, it is not clear whether new COVID or flu shots will be available come this fall. Here to discuss this is Dr. Kavita Patel, clinical physician and former senior policy director during the Obama administration. Dr. Patel, it's great to see you again. Why roll back these COVID recommendations?
Yeah, Eamon, I expect we're going to hear more details tomorrow as FDA briefs the public. But what they've alluded to is that they want to take on what they call a risk-based framework. So before, obviously, when we were in the thick of COVID, it was really just about getting as much immunity across the board. Now that years have passed, almost everybody, if not in the entire world, but certainly many Americans have been infected not once, twice, but even more than that. So immunity from infection combined with some vaccines might be just enough immunity instead of expecting everyone to get vaccinated. That sounds very logical, Eamon, but the problem is that when you're doing public health campaigns, it's hard to apply that level of nuance. So I expect to hear more details tomorrow. And hopefully it'll be more clear, but it does certainly feel like we're just rolling back all vaccine recommendations.
Why do you think the administration wants to make this change? I mean, I guess maybe another way to ask it is, are these changes necessary, or are they just kind of trying to perhaps fulfill this kind of campaign political promise that they had made?
I think you're seeing both. I do think that it was necessary, just like with any science, Eamon, I think it's necessary to revisit and understand what we're trying to deal with when we deploy a massive vaccine campaign. Take flu, for example. We update the flu vaccine because the flu virus changes pretty significantly, so we need to update the vaccine for it, and we have a seasonality that we can expect. You can certainly get flu cases kind of off-season, but the majority of our cases are in the thick of the winter season, and we still, unfortunately, have a lot of deaths, both in young and old. With COVID, we're seeing this immunity where we have not just people who have been infected, but some vaccinated. We do have an immunocompromised cohort that can include, unfortunately, young people, pregnant people. So it does include the population that the early reporting has suggested they might eliminate recommendations from. And that's where it comes to your comment about, could this be political? There has been a very clear kind of, you can call it an anti-vaccine sentiment. I call it kind of a broader fire for public health. They've eliminated parts of the CDC, eliminated important parts of HHS, and basically kind of zeroed out many of the budgets that would be responsible for studying vaccine hesitancy, not just COVID vaccine hesitancy in general, all while we're seeing over 1,000 measles cases, Eamon. So I do think it's both at play here.
Of course, the big headline as well this week is that the FDA is also reevaluating the safety of mifepristone, also known as the abortion pill, despite its use for decades in this country, safe use for decades in this country, after a flawed report claimed that it has a high rate of serious complications. Tell us a little bit more about the report that's fueling this push.
Right. So amidst decades of research and clinical experience, and by the way, incredibly safe, rigorous safety standards where we had to put in extensive reporting on every prescription that we would write for mifepristone, there was one report that reported 22 times more kind of adverse events than any other safety reporting mechanism that we have. Now, that report, that it's not even a study, Eamon, I just want to call it kind of for what it is. That report that was a convenient sample, if anything, has been debunked and kind of taken apart by peer-reviewed literature. Unfortunately, it's out there in this open era of the internet. People will only read a certain amount, and that makes people lead to the tagline on social media that this is somehow fact. So I do think that you're seeing dots being connected that are not true, and that kind of misinformation, truly, that's what it is leading to this erroneous pressure and push to reevaluate what I kind of always thought all along we would see is a new administration, a Trump administration, reevaluating mifepristone. I would urge the FDA commissioner to make a very clear kind of distinction about the data of safety that we've had for decades, and to kind of take that into consideration and to not roll us backwards in terms of access, but we'll see.